In this video, I'll be discussing the policies and procedures for sending medications to your child's preschool or childcare program. For acute illnesses and over-the-counter medications, emergency medications for conditions such as allergies or seizures, and medications needed for chronic conditions such as asthma or diabetes. First off, it's important for you to know that having medications at a childcare program is a huge liability for childcare providers. For that reason, there are strict processes and policies in place. It's not just to make life difficult. There's a lot of paperwork that sometimes surprises parents and results in a delay in their child starting in the program. I can't tell you how many times a child was scheduled to start in one of my programs, but they showed up on day one with a medication without a prescription or without the required forms completed by the child's doctor or specialist and the parent. And there's even been parents who didn't think to mention that their child requires medication until their first day, and they bring it as if they're dropping off their snack or their backpack. Meds are a totally different category. In these cases, the children were unable to attend the program until everything was completed, which left parents unexpectedly without childcare for several days or weeks. Because most doctors' offices are way too busy to complete forms immediately when requested, and this is something that most childcare providers will not budge on making an exception because it would be a huge risk and liability since it would be breaking licensing requirements. And side note, if the program is willing to easily break them, that's a red flag. They are probably breaking other rules. Moving on, it's good you're watching this video so there are no surprises and you know what to expect. There's typically quite a bit of paperwork that needs to be completed by several parties. The exact process will depend on the state you reside in and the center's policy. So during the enrollment process, one of the first things you'll want to bring up is your child's health and medical conditions. It's essential to be transparent and share as many details as possible about your child's health and medical conditions with the childcare provider. First, let's talk about acute conditions, meaning short-term illness such as pink eye or an ear or sinus infection. Now, most centers will not allow any over-the-counter medications such as Tylenol or Motrin to treat acute conditions unless it's prescribed by their pediatrician. The policy probably is, if they need to be taking those types of medications, they are too sick to attend the program. Some parents do give their children Tylenol or Motrin and then bring them in, but most times teachers are able to tell. I swear it's a sixth sense. Either the meds will wear off and the fever comes back in the afternoon for babies or toddlers who are nonverbal, or their behavior is off, or preschoolers will simply tell us, "Daddy gave me purple medicine this morning and told me not to tell you." Being lied to about it is definitely a childcare teacher pet peeve. If over-the-counter drugs such as Tylenol or Motrin are needed for a chronic condition, such as if a child has febrile seizures if they spike a fever, then it would be considered an emergency medication and permitted to be kept at the center with the proper paperwork. For prescribed medications for short-term illnesses that are no longer contagious but need to be taken for several days or weeks, a center may require the parent to come during the day to give their child the medication or to give it to them before or after school. Or if the center policy allows short-term medications, they will give the medications such as eye drops for pink eye after it's not contagious, or antibiotics for an infection with the required paperwork. If this is the case, when your child is sick and you bring them to the doctor and meds are prescribed, you want to ask them to complete the required forms for preschool or childcare during the appointment to avoid having to call them back and chase them down. Delays on paperwork will result in a delay in your childcare provider being able to administer the medication at the program. Simply put, whenever you're at the doctor and doing something health-related for your child, always keep in mind that something is likely needed for childcare, whether forms for medication or a doctor's clearance note as to when they're no longer contagious and can return to the childcare program. And before you bring them to the doctor, make sure you check with the center's director or other center administrator as to what forms are required to ensure you have the correct forms and documentation. Too many times to count, parents will bring a form provided by the doctor, but state licensing or the center requires a specific form and clearance, and then they have to go back and get the correct one. Just save yourself the hassle. Now let's talk chronic illnesses and conditions. If your child has a chronic condition such as asthma requiring an inhaler and or a nebulizer, or an allergy that requires an EpiPen and or Benadryl, seizures or diabetes, etc., you'll want to let the center's administration know as soon as possible. This is for two reasons. Firstly, so they can provide you with the necessary forms required to keep the child's medication at school, and secondly, so that the program staff have time to be trained in administering that particular medication before your child starts in the program. Although many early childhood teachers and staff are certified in administering medication in general, certain conditions require additional specialized training, such as learning to take children's blood sugar levels if they have diabetes, or how to insert emergency medication in their rectum for a seizure disorder. Yep, you heard that correctly. Indeed, childcare teachers are heroes without capes. The general paperwork that is required is an action care plan from the child's doctor that details what the child's plan of care is for this condition while they're at childcare or preschool. There will also be a form completed by the doctor and parent authorizing a certain medication to be administered to the child and details such as the dose, frequency, and side effects. There may also be a medication administration record form, and the child's condition should also be noted on their health assessment, otherwise known as their physical. Super important things to note when bringing in the actual medication. Most centers require the medications to be new and unopened. The medication must be in the original container, so if it comes in a box, leave it in the box with the prescription still on it. The medication must have the current prescription on it with the child's name. Sometimes a prescription for certain equipment to administer medication to young children is also required, such as the spacer for an inhaler in addition to the inhaler prescription. Also, the medication dose must match the prescription noted on other forms. For example, sometimes we'll receive an EpiPen, but the doctor's form states they should have an EpiPen Junior. And make sure you've given your child at least one dose of the medication to ensure they don't have an adverse reaction to it, except for emergency medications like an EpiPen. All of the forms of medications must be renewed annually. Usually the program's nurse will notify you a month or two before to get new paperwork from the child's doctor for the medications and to review and revise the care plan if needed. Again, depending on the licensing regulations where you live and the specific program, policies and procedures may vary slightly. Check with the program's director or enrollment coordinator for specific details on the process at your center. Is your head spinning yet? I know, it's a lot of information, but even so, I hope this video was helpful to give you a heads up so you can manage your expectations. The Childcare Program Administrator will be able to help walk you through the process. I hope you found this video helpful. If you did, I'd appreciate a like and feel free to subscribe to my channel for more childcare and preschool tips and tricks for parents. See you next time.